Coughing is a common reflex action that helps clear the airways of irritants and mucus. However, several myths and misconceptions surround coughing, leading to confusion about its causes and treatments. In this discussion, we will explore 10 common myths about coughing and unveil the actual reality behind this natural bodily response. Myth 1. Coughing is always a sign of a serious illness. Reality. While a persistent cough can be a symptom of an underlying health issue, most coughs are caused by minor respiratory infections and allergies, which usually resolve on their own. Myth 2. Coughing is contagious. Reality. Coughing itself is not contagious, but the viruses or bacteria that cause certain respiratory infections leading to coughing can be transmitted from person to person. Myth 3. Coughing always requires antibiotics. Reality. Most coughs are caused by viruses, and antibiotics are ineffective against viral infections. Antibiotics should only be used when a bacterial infection is present and prescribed by a healthcare professional. Myth 4. Suppressing a cough is harmful. Reality. Coughing can be distressing and disruptive, especially at night. It is acceptable to use over-the-counter cough suppressants or natural remedies to relieve discomfort and improve sleep. Myth 5. Coughing is only a respiratory issue. Reality. While coughing is commonly associated with respiratory conditions, it can also be a symptom of other health problems like gastroesophageal reflux disease, GERD, or heart issues. Myth 6. Cough drops are the same as candy. Reality. While some cough drops may contain sugar, there are sugar-free options available that can help soothe the throat and alleviate coughing. Myth 7. A chronic cough is normal as you age. Reality. A persistent cough is not a normal part of aging and may indicate an underlying health condition that needs medical attention. Myth 8. Coughing during exercise is a sign of poor fitness. Reality. Coughing during or after exercise can occur due to exercise-induced asthma or breathing in cold, dry air. It does not necessarily reflect overall fitness levels. Myth 9. Coughing can permanently damage the lungs. Reality. Occasional coughing is a natural protective mechanism and does not cause permanent damage to healthy lungs. However, chronic coughing may lead to throat irritation. Myth 10. Herbal remedies and homeopathic treatments are always effective for coughs. Reality. While some herbal remedies and homeopathic treatments may provide relief for certain individuals, their efficacy varies, and it is essential to consult a healthcare professional for persistent or severe coughs. Coughing is a natural and important reflex that helps protect our respiratory system. By dispelling these myths and understanding the actual reality of coughing, we can better address and manage this common symptom. If you have concerns about your cough or its underlying cause, it is crucial to seek guidance from a healthcare professional to ensure appropriate diagnosis and treatment.